Good afternoon, today is June 6th, and today I'll continue to talk about the coronavirus. So the first piece of news that I'd like to talk about is Japan. When the coronavirus first arrived in Japan, Japan did many things incorrectly, with poor social distancing, still opening karaoke bars, and public transit was packed near the zone where the worst outbreaks were happening. However, Japanese people did put on masks, which were nothing new in Japan, and as a result, Japan has only reported more than 70,000 infections and just over 900 deaths, while the US has topped 1.9 million cases and is approaching 110,000 deaths. So masks were nothing new in Japan, as the history of mask wearing in Japan goes back hundreds of years, and the Japanese people have worn masks with flu and hay fever seasons, and trains often crowded with commuters half hidden behind white surgical masks. Employees with colds worried about the stigma of missing work went on and still went to work. So as a result, I think Japan did basically just protect this country from the virus with this universal mask wearing. And now there's definitely evidence coming out of COVID that Japan, as well as other countries which practice mask wearing, tend to do much better than flattening the curve, according to a professor of immunobiology at Yale. And so I think what's important is that US, which did not embrace universal mask wearing, is suffering severely, and I think it really shows the importance of wearing a mask, especially if you're going to go out. So this can be just shown as a piece of advice that I would suggest you take, because obviously if Japan, which did everything wrong except for mask wearing, managed to be able to survive the virus pretty well, then I think you can definitely protect yourself from the mask. And I think this is what Japan did the best during this coronavirus crisis. And I think this is something that other countries can learn from as well. The second thing that I'd like to talk about is that how the coronavirus might affect pregnant women and newborns has been a major concern since the outbreaks began. However, a new report in the medical journal JAMA has both reassuring and worrisome findings, with caveats that there is limited data and still much unknown. So far, the study showed that pregnant women do not seem to have an increased risk of severe illness compared to the general population. In some studies, they actually had lower risks, and the rates of having critical illness were actually lower than in the rest of the population. So I think this can just be an extremely reassuring sign in that pregnant women perhaps can still be able to go outside and exercise, which is very important for pregnancy, without showing the doubt that they may be carrying extra risk. And however, there are still many questions that are unknown, including whether an COVID infection can cause birth defects, miscarriage, premature birth, or stillbirth is still not yet known. Newborns have become infected, but it's not clear whether they contracted the virus before, during, or after birth, or if breastfeeding can transmit the virus. So these factors are really important in saying that. These may be questions that perhaps pregnant women are still worried about. However, the study also said that women who are wondering whether this is a safe time to conceive children said for this question, I think there does not seem to be a compelling reason to recommend delaying pregnancy. And so perhaps if you are pregnant, then you shouldn't worry too much about it, and I think you should just focus on having a good pregnancy throughout. That's it. Thank you for listening, and I hope you have a good day. Thank you.